Dānít'ádā, Âba Wathtech. Hello and welcome to the G4 Talks Health podcast. Today, myself, Margo and Colton go to the Health Quality Alberta offices, our HQA, and sit down and have a discussion with Kristina and Maz from HQA. G4 Health and the Health Quality Council of Alberta partnered on a unique engagement with the communities of Bighorn, Eden Valley, Îyethka and Tsuut'ina to discuss end-of-life and palliative care from a Îyethka and Tsuut'ina perspective. The engagement was held on September 30th of 2023. In this podcast, we give an update on the report and reflect on some of the teachings that we learned and have stuck with us, both from HQA and G4 Health. We are grateful for all of our communities and everyone who participated in contributing to this report. Warning to our listeners, we do discuss topics surrounding death and dying in this episode. We hope you enjoy today's informative discussion.
Hi, this is fun. So I'm Kristina Watkins. Many people call me Chris. I am a senior engagement advisor here at Health Quality Alberta. Other words that I use to describe myself: I am a settler, I am neurodivergent, a mother, an immigrant to this land that we call Canada. I've been here at Health Quality Alberta for about 10 years now, always doing something connected with talking to patients and families and trying to ensure that those we serve, that their voices are brought to our work. So that's a little bit about me.
How's it going? My name is Maz Raman. I've been here at the Health Quality Alberta for just actually over 4 years now. My background's kind of in data analytics, quality improvement, a little bit of engagement work as well throughout all of that. But I've had the privilege of working with you folks on this project and with Chris as well. And it's been really an eye-opening opportunity to do engagement differently and specifically around palliative end-of-life care. But yeah, just excited to have a chat today with you folks.
Hello, I am Margo Dodginghorse. I'm the health director for G4, Stoney Nakoda Tsuut'ina Tribal Council. I had the honor and privilege to create G4 Health, which has been quite a wonderful experience for me. I've always worked in multi-nation advocacy, so I'm going on over 2 decades now. So it's been a long go for me, and it's really insightful to be able to explore new topics. This was something that I think was alluded to but was never really focused on, and I think how things come to life is really important. And this was more of an opportunity to sit in on a meeting, and it turned into this beautiful process that we're growing. My background is in health advocacy, First Nation advocacy, and that's just something that I will probably do until I'm old and gray. And I really felt that this process was meaningful and impactful, and I think the partners were meant to partner on this. I don't think it was out of nowhere. I think it was actually meant for us to go down this path together. We learned so much. It's been beautiful and challenging at the same time, and I really felt that we brought life to such a often looked at dark issue, and it's not a dark issue. It's actually quite beautiful when we explored it further. But that's who I am. I'm originally from Siksika. I call Tsuut'ina home. I'm a mother of 3 and a pug mom of 1. Shout out to Dennis.
Bro Dennis.
Yeah.
Bro Dennis. Hello. My name is Colton Crowchild. I'm the official title is the Digital Communications Coordinator for G4 Health. I kind of take whatever gets thrown on my desk, and it kind of depends on the day. But I'm kind of coming into this a little bit later in the development. So Dalton gave me a briefing earlier about how this report came to be and kind of the work leading up to it. And I kind of caught the tail end and finishing the printing and that sort of thing. But once I got into it, I realized, like Margo said, definitely a beautiful thing and not something to shy away from. Although it may be a little bit difficult to talk about, or people maybe do shy away from it, I think it's definitely an interesting topic to at least bring to light and just discuss it in any way that we can. But that's a little bit about me. I'm from Tsuut'ina, somewhat recent addition to the G4 Health team. That's me.
Right on. Yeah. Then Dalton Dodginghorse. Yeah, if you've been listening to the podcast, I've been doing the back end of the podcast. But yeah, the content creation. But yeah, I wanted to ask how the partnership began with the HQA and G4 Health, because I don't know if I was here for the initial beginning.
I think, Maz, you could really go into that because I was invited from more of my role as a First Nation health technician, and I think that's how I came into the space of this project that was an existing project before it turned into this process.
Yeah, for sure. So back in 2023, I think we started. So I lead a project called Focus on Healthcare, which is an online reporting platform designed to show different health indicators in the system. And as an effort to show the entire system, we found that palliative end-of-life care was lacking. And so anytime we do any sort of development work, we always try to bring different people from different backgrounds and communities with expertise and knowledge. And so when we started the process of developing the palliative end-of-life care segment on Focus, we invited Margo and others to that process. And the approach that we were using at the time was a Delphi process. It's kind of a survey that we send out, and we collect and basically throw a lot of information at you and try to get it down to a very specific set of measures. And through that process and that engagement, we had really good feedback and engagement where we learned that the approach we were taking doesn't really represent the voices of First Nations and Indigenous communities. And so from that, I took that to heart personally, and I reached out to Chris and others within our organization and said, what can we do differently? How can we capture some of these stories around end of life and passing and bring that to something that's more meaningful? And so that's where the conversations kind of started. And from there, we kind of had further conversations to see how we could partner together and do something different, which led to the engagement we had on September 20th in 2023. But that's kind of the background of how it started, was kind of an advisory group that we had brought together with different folks to talk about palliative end of life, which led to our learning and our kind of understanding that maybe the approach that we were taking wasn't the most appropriate one, which had to really sit and think through for us to really understand where the gaps were, and to do something differently. And I think the curiosity of our group and our organization at the time was still open to the idea of working with different communities and kind of approaching engagement differently. So this was kind of a blessing in disguise, because we'd run with that opportunity, right? And Margo reached out to us, and we kind of took it from there.
It was interesting because when I was part of that original focus session with the Delphi survey, one of the things that I shared with the group is that these are numbers on a screen, and they don't really show like the heart and the compassion behind those individuals. And when we're talking data and survey, we represent it through numbers, right? And we start to see, X number of deaths or X number of people in palliative care. And I think the real challenge was making sure that we honored those individuals that were reflected by those numbers. And I think we had this sidebar conversation to say, well, how can we now hear and put heart and meaning to some of the information that we have. We know the information is there. It's helpful for us on a technical side, but when we're talking about such a personal experience, it's hard to see it as numbers on a screen. And I think that was really interesting. Even like the timing for me personally in my own life was really connected to this. And, we're coming on the 1-year anniversary of my brother's passing, and I think that's maybe where you become more of an advocate, because you have lived experience and you start to honor those who have gone before us. And through this process, one of the things that we're really keen to doing is getting elders and knowledge holders to give us their blessing, because we knew that this was uncomfortable territory for even ourselves as technicians collectively to have those types of conversations. And that was something that we did before we even went into engagement, is we brought this idea of end of life and palliative care to our elders group. And that's what kind of opens the report. It's we talk about some of the messages that they shared in that room. So we developed this advisory group, and then we also sat with the elders in a really I guess I had just a really humble way. We didn't come with this big formal agenda. We were basically like, give us some guidance because we know this is going to be hard, personally and professionally for us. And it was really really up to them if they wanted us to go forward. Like if our elders and our knowledge holders said, no, this is not a topic that you should explore, we probably would have just stopped right there. But they were able to actually give us some reflections, and we shared those in the engagement with the larger group as a way to set the tone for the day. And I remember it was a hard day. Yeah.
It was, and that was the first time that our team, that we had worked together, period. I think that that's an important nuance, is that it wasn't just that you gave us the feedback in that meeting and we had this long, I mean, we had done a couple of reviews, but it's not the same as doing that intimate one, like nation to organization kind of partnership. And you made such a generous invitation to us, Margo, you and your team did, for us to come on that journey with you. And yes, it was, I'll be honest, it was nerve-wracking to enter that first meeting with the elders, because it wasn't just, for us, it wasn't just about seeking that support, it was also getting to know you. And I very much appreciate that us being part of a settler-led organization, that can be, you got to take some time and get to know each other and make sure that this actually feels like something that's appropriate and meaningful to step into. So that I took that very much to heart, that they did feel comfortable to give us that guidance and encourage us to step forward with courage.
Even in the beginning parts, do you remember, Chris, we started to kind of borrow some other like Indigenous teachings, and we started to, we had like this whole, package of supportive documents that are going to help us get to this place. And then we kind of started to sift through and filter out like what wasn't going to actually make a difference for us. And I think there was ways of sharing and just different teachings that were not necessarily ours, that we said, let's shelve this, let's consider what they say, but let's put this aside and see how best our spirits and our own hearts will guide us through the process. And it was really interesting because even using like the medicine wheel, like we recognize that those aren't our teachings, and we did reference that we have our own teachings, but being mindful that is a more of a, it's a more well-known model that people can relate to. And so we did reference, but I think we really broke down a lot of the walls that we're used to working in. What is Indigenous inclusion? Well, if I go to this website, this is what it tells me to do. And we really stepped into an uncomfortable place to learn from each other. We, had very limited information of what was HQCA at that time, which is now HQA. We had very limited information with what your team did. And as we started to explore, we're like, we're not so different after all. And we started to understand that we share parallel roles, and we're able to kind of teach each other along the way, which was quite beautiful. I really enjoyed that.
Yeah. Well, maybe to take a step back, can you kind of touch on it a little bit, like maybe Chris or Maz, can you explain a little bit about what HQA is, but formerly HQCA, kind of explain what your role is in this partnership, and kind of how we all should know you guys, I guess.
Health Quality Alberta, we are a provincial agency that brings together patients, families, and health partners from across healthcare and academia to inspire improvement in patient safety, person-centered care, and health service quality. So that's really our area of focus, and it's really broad. We report to the Minister of Preventative and Primary Health Services, and they can ask us to look at anything. So one great thing about being here for so long is we've been able to explore different paths, and this is one that we took down: palliative and end-of-life care.
Nice. Okay.
And that's where we connected, because it's like, that's what we do too. Like, we are actually, our board, we're governed by a board of directors that's comprised of our chiefs, which is, our leaders in community. And same way, like, they could ask us to explore something that may not have been in our work plan, or may be outside of our comfort zone. And you learn a lot in those moments. And I think having curious leadership is really important in developing ways to look at other topics that we wouldn't normally, kind of stick to our comfort zone. And this is an opportunity to kind of, and so when I learned about your role, your roles, I was like, hey, that's what we do. We're advocates too. We talk to the citizens, and we, health directors, we meet with regulating bodies. Like, we're trying to understand the big, complicated healthcare system picture, because it's messy if you look at
And it's so tough because so few people have that time and space to hold space, to look at those topics. And that's both of our organizations. Yeah. That is our role, is to take that time and take that space and try to understand something. And then be what, as an engagement practitioner, I call a middle agent, where you're really kind of walking between those worlds and trying to help bridge those ways of understanding to help hopefully make good decisions that support the people we serve.
Yeah, I was just thinking about how the unique partnership between a non-First Nations and a First Nations organization means you could have that exchange of info, where you're not going to have these pan-Indigenous the resources that were made about us but not by us, right? And we have an opportunity to share that stuff here, and if hopefully it could keep going, and you could see down the line there's way more of these examples of partnerships, because I think previously we've just been living through a time where it was just info made about us and assumptions, right, from the Western worldview. But now it's just and we say just to sit down and talk to a Stony or Tsuut'ina person, right?
Well, that's a really neat point, because remember when we first started this report, we wanted reference points for everything, and we had to take an uncomfortable step back to build this reciprocal understanding and this knowledge between each other, to say, I recognize that that's important to your organization, but what we're trying to do is decolonize this approach, to know that way back when, elders would give us teachings, and he wouldn't say, but why? And how come? And where do I source this? It was very much because these are the teachings, right? And you take them.
Annotated bibliography.
Yeah. But it was, honestly, that was one of there were many key moments during our learning journey, but that was a really big one for me, because I think that we are, and just historically, in more Western academic leaning spaces, there is one good definition for things. And your team really helped me to not just acknowledge, but really embrace that idea that you, Colt, can have one view on what that means. Margo can have a view, Maz, Dalton, we can all view a term or a concept or some idea one way, and that's okay. And that's good. And actually, that's really beautiful, because the ways that we view it, that's what makes it rich. And we don't have to make it narrow. And I love that. And so now that's something that I've really brought into other work that I've been a part of, and something that I've already been carrying forward from our partnership.
And we were so practicing our own humility when we did this report, because we even talked about how surface level it can be misinterpreted right off the bat, but the goal was to encourage people to read it from start to finish, and whatever the interpretation is, maybe that's a teaching within itself, but that it was guided through a dual world perspective, which was really important for us. But we did practice that humility and say that our hope is that people learn from this. It's not, we can't define it for you, and how individuals may digest the information, or it's supposed to be a heart piece. It's not supposed to be, this is the highest level of academia for end of life and palliative care. It's really supposed to be wholesome and loving and compassionate and kind, and also challenging at the same time. Yeah.
I think, talking from experience in Tsuut'ina, I know a lot of families already kind of disagree about things. So it's we don't want to make something to fuel that disagreement. It's more about respecting the individual families and saying, because one of the things I had to do was find the word, the Tsuut'ina word.
Oh yeah.
For dying, and even that there was a bunch of different terms, because each family understood it. And Tsuut'ina is a very descriptive language. So if each family is viewing something differently, it's going to come out with a different translation. So I found that right away, is that it's all just about respecting the individual families and what their traditions are, right? Mm-hmm. Yeah.
Well, I guess with all the points of having such specific knowledge with each group or each person, Were there any commonalities you guys found? Obviously, I'm just asking because I wasn't actually in the engagement session. What were some of the things that helped inform your work going forward? What were some of the commonalities you found in the reports?
The funny thing is, when we started this process, we talked about how there was a lot of differences, but actually when we got to the session and we actually had the stories and we had a chance to actually sit down together, there's actually a lot more commonalities in terms of death and dying and passing on. And just at our table, we had conversations around that this isn't the end. This is actually a continuation. It's a journey. And I know a lot of other cultures view it the same way, right? It's not that, someone's life is ending. It's actually that their journey is beginning. And there's a whole nother perspective to death and dying when you look at it that way. And then the aspect of community, that was huge. That came up in our conversations on that day, how community and relationships are so important, that when somebody passes away, that there's feasts and there's food and there's community and there's gathering. And my community, or even within our religion, it's the same thing. There's a lot more commonalities, I think, that people, once they get to know what's involved in some of these conversations, and when we share some of these stories between different cultures and communities, we actually have more in common than we think. But that was a big realization for me, is we're going into this thinking that there's different worldviews here, different conversations, but in reality we're actually very similar in terms of how we view death and dying or end of life care.
Yeah. I found one of the really important things was, once we kind of got into the conversation, we left our titles at the door. We all have, these roles that we play within our organizations, but during those conversations, we were just Margo, Maz, Chris, Dalton. We were all just ourselves, and we were able to be human and connect in a human way. And I was really interesting, because I think we were a little intimidated at first. We've never done a partnership with the Health Quality Council of Alberta, right? And you've never done a partnership with a First Nation organization at this level. And I think there was a lot of intimidation, but once we kind of realized what we're doing, we're able to kind of release the title and just be humans having conversations with humans. And I think that's really where the compassion, the love, the understanding. And I think the other common thing was nobody pushed too hard. So we knew that there are rights that all of us have within our own family structures that we can't manipulate because we need to write a report or because we want to write a report. Nobody pushed anybody. And I think those who felt that the conversation was too heavy, we really kind of moved and flowed with the pace of the participants, and even the supportive team, because we were part of those conversations as well. And I think I had an opportunity to kind of go from table to table and just observe, and I felt that same energy from each table, regardless of who was leading those conversations. And I thought that was really, really nice. It was really nice. Yeah.
Yeah, it was good. Yeah, I definitely, I was stuff was coming up for me too. It was oh yeah, I'm not alone though. Because it was oh yeah, there's everyone. There's a whole room full of people going through that stuff. So that it felt a little better in a weird way.
And people felt that connection. I actually went back before I knew we were going to sit down and have this conversation, and I actually read the feedback that we got, because we did ask at the end just if folks wanted to share any reflections on how the day felt for them. Not making assumptions, that it did feel comfortable. And so many people took the time to tell us that they appreciated that time to connect, to hear from each other, to learn from their neighbors at different communities that they don't always get an opportunity to sit down and talk with. Oh, I'm going to get choked up. Honestly, it really, I'm just taken back to that moment.
Yeah.
And it was really nice. I mean, you were at my table.
Yeah,
we just, and Dalton even offered just some good guidance to me occasionally. And it was just really warm and supportive.
Yeah.
And people felt really comfortable to share. And then other commonalities, I have to add the laughter. I know Sylvan is not here today, but I'm going to bring him into the space because he made us all laugh. And it really lightened up, with this being such a heavy topic. And that's kudos to your team. I have to say thank you to your team for really keeping the wellness of the participants top of mind at every stage of the planning, and then even there in the space together. And, you know, we took a moment in the middle, and, you know, Sylvan did an activity with everyone, and it was just, we all laughed.
Yeah.
And that laughter really, I think, just kept us light in a good way, so that it could remain beautiful and not have us, you know, feeling that heaviness and letting that weigh us down. So.
Yeah, the laughter definitely was good. Yeah, Sylvan's good for that.
Shout out to Sylvan.
Shout out to Sylvan.
But even like when we look at some of the reflections, one of the things that our knowledge holder and our elder had shared with us was we can be happy and sad at the same time. And like for our loved ones, and even in life, right? That it was very two-sided, the conversation. You know, there was crying and there was laughing, like at the same time. and it was. I thought it took me back to times in our own communities where you go and visit a family who may have lost a loved one. We're not sitting there just, you know, in despair. Obviously, it's the worst pain you can go through. But you're leaning on each other and finding solace and a story that'll bring you to laughter, and a story that'll make you remember, like, oh, that was a pretty cool lesson, or, you know, I didn't even think of it at that time, like, you know, and that's really what I felt in that room as well. And I think that's our elders setting the tone. And these reflections, we actually gave everybody a copy of them just to look at them. Like, if the conversation got too hard, look at what our elders have told us and have shared with us. And a lot of those things, they're really about love, and that end of life is sacred, community. There's a better place, you know, where, not that this place is terrible, but that passing is still a part of our journey as well, and that we have to be able to look at our world and the world that we're passing to in the same appreciation, you know, not encouraging it, but also not discouraging where our loved ones are going. They also talked about dual belief systems, which I really respected, because I think there's this misunderstanding that when we advocate for First Nations, we're only advocating for the spiritual side of our belief system, but we have a lot of people in our communities that really resonate with the religious side. And this session that we had really honored that dual belief system, and I think we're able to understand that people do reference the Bible and they do reference Jesus, but they also reference Creator and medicine and all of those wonderful things. So I think that was really, I really appreciated that dual world view. And then recognizing our differences was what they had shared with us. And then also the example we gave of Sylvan coming in and kind of just giving us an opportunity just to kind of like, oh, I need to breathe. You know, this conversation has been a lot. And he came in and did some icebreakers, and just to calm our nerves. And it's really that building self-care into these kind of conversations. And we've been a part of a lot of engagement that you leave pretty heavy. And surprisingly enough, with this engagement, I didn't leave as heavy as I've left other engagements. You know, if I'm talking about budgets, or if I'm talking about racism, right? Like you leave pretty heavy, right? Where this, you would think like this is a pretty heavy topic, but I left feeling really peaceful. Yeah, I still do, right? When we talk about it, I'm like, this is so unique, and yeah, it's a unique process that we did.
I really like what you said, Margo, like holding like those two emotions at the same time.
Mm-hmm.
Like superficially, I think you may assume you can only have one or the other. Like, oh, you're sad now or you're happy now. I don't think they really blend well naturally, at least in my own head. I don't know if anyone's familiar with the TV show Reservation Dogs. There's an episode where one of the main characters, Elora, her grandma passes away. And I think I resonate with that because I think it's probably the funniest episode in my opinion, but it's also the saddest. Like, I've laughed so hard just in my own, watching it on my iPad, and I've also cried watching the same show. I think they just really hit it on the nose, where people come together in like what you perceive to be the worst time, but then you build memories and you connect with people that you haven't connected with in the past or in a long time. the cousins come out of the woodwork, and you see people, your distant relations come into town, and it feels very welcoming and homey. And even like for myself, and recently when my grandmother passed away, I met some people I've always heard about but never met them, and then now I have these lifelong connections that have made sense. And a lot of my extended family came to town. It just really felt like it comes together, and there's that happiness within that despair or within that sadness. But I think that really, they push against each other, but they'll also push each other forward. And I think that's really how you kind of get out of that, and you keep moving forward, and it allows you to process it a little bit more. But I definitely love what you said.
Yeah, and that even like we react, and I'm reading this because I think it's just beautiful and it's important to share, but the elders even shared with us how we all react to death differently. Some of us may just need to keep crying, right? Or some of us, what we learned is that there's even protocols where you can't cry. And that was really interesting because, when we look at that, that infusion of this dual world reality that First Nations have, there's so much influence of what we're told to do and what our rites of passage have guided us towards. And I think that was really interesting because there is no right or wrong way to grieve. How, you don't just you're born and you say and when it comes to time, here's your handbook on grieving, right? And I think that was what our elders encouraged us, was to honor that. And looking back, hindsight, it's pretty interesting because we did do that. We really honored everybody at the table. You had the ones that would share the laughter and the ones that would be really vulnerable, and both were unique in a way, for sure, but we all grieve differently. And the report's not fully on death and passing, it's also on palliative care. And that was really interesting because what we learned what Dalton shared with us, and Dalton, you can correct me, but palliative was a really hard word to define in our language because we wanted to have the two words, and we thought, okay, well, it's really difficult to define palliative care because palliative care doesn't always mean that it's the end. There could be, even through our own ways, there could be miracles that we've prayed for that happen. There could be advancements in the health system that we have failed to search for and have found answers in those ways. And it was part of the process was really teaching the understanding of palliative care, and that was really interesting for us as technicians who don't usually talk about this item. And okay, how do we just not only focus on the death aspect, but there's also those near-death experience, or those feelings, those places that make you feel like the individual is dying, but they don't necessarily all pass away, right? It was really a learning experience, I think, not only for our participants, but even for us as technicians. Of now, how do we explain this to the elders, or how do we explain this to our first language speakers? Because a lot of it, when we don't all speak English, right? And so how do we make sure that what we're sharing is not harmful, but it's shared in a really good way? That was tough. That was a tough part.
Yeah, I felt there was kind of a barrier to ask, just jump in and be like, what's the word for dying? There was a lot of you could tell the emotions are coming up too, even asking. But
and
then,
that was about a month and a half process for you. It
Yeah, it
wasn't
took
a
a
quick
while.
process. Yeah, it wasn't fast.
And I remember they went back and were like, we're gonna wait, I'll get back to you. And then I got a call back, and then they explained that they didn't have a definitive word, but this is what was said in my family, and this is what some other families agree on, and it's more so to do with they're not with us here currently. They've passed, right? It's almost like if somebody left the room. It's just they're not here. So it's interesting to say that there wasn't words like that, So that was good because then I learned some of the language too.
Yeah.
Yeah, good opportunity.
And even the validation Dalton took, he'd go from elder to elder, and we, this is for the purpose of this report, but we recognize that there's a number of other ways to translate it. And when you start to kind of understand First Nation language, a lot of the time it's what are you trying to say? What are you trying to explain? Because there's different words that an English word is one word, and that's kind of it. But like a First Nation word is, okay, well, what's the scenario? Because there's many different words that we can use, but what's the scenario? What are you trying to explain? What emotion are you trying to bring out? And it's so deep, and like it was really, for us to come with 2 words, that was definitely a challenge, and I think there's many, many others. So acknowledge the other words, that this is only a template. This is only to gain perspective, but we know that when we explore these, and we also recognize that all of our communities, although they are Stoney Nakoda and Dene, there are other First Nations and other backgrounds living in our communities that we wanted to honor as well. To know that, if you have a family of, Dene and Blackfoot people, there may be different belief systems there and different words that people will use. So we really tried to honor that as well, to recognize the different family structures that exist in our communities. Yeah.
Just on that, with the two worlds, I wanted to touch on, because I was reading this morning, where it was, there's this assumption that like First Nations people just want the traditional way, but it's like they also want good care, like in a Western center, right? Like, but it's both. It's not like they want the freedom to express the traditional traditions. They don't want to be just kind of left stuck in, I guess, in one world.
Give them the option for whatever they want,
exactly.
Whatever they choose.
So that comes up too. I remember when we talked about it, a lot of things came up about like quality home care, and maybe like renovating homes, and then also care on the nation. It kind of led into other topics that were really useful too, even though it wasn't about end of life. They were informed us about like what people wanted, in the communities.
Well, I guess on that, what were some of the challenges? Like, what were some of the things that people brought up that they wanted to see more of, or more inclusion? What were some of those things?
I think home care and palliative care. Palliative care on passing in your own home on the nation. It was like, how do we get the capacity for the staff, and also like how do you have the mental health for the staff, and that they're trusted. That
fair. You can't just bring anybody.
You can't just bring anybody, and
exactly.
Making that like accessible too. That they said the homes, they needed the space for hospital beds. I remember those ones were some just off the top.
And that's what like one of the reflections were, like what Dalton was talking about is we have choice. So we have choices on how we want to be cared for, and if that includes traditional or contemporary ways, the choice is there. And we did reference like the UNDRIP and the TRC. So we tried to reference some of those rights that we've really affirmed. Collectively as Indigenous people, we have affirmed our own ways of knowing, and I think that was one of the challenges I think we really encountered, was really getting out of our comfort zone to actually talk about this. Like, we have several recommendations, I think 6, but they have several information, like a lot of information attached to it. And I think the real difficult thing for any engagement is really creating trusted spaces to know, like, what are you going to do with this after? And that was real, like, informing people, but you're teaching the whole way. You're teaching what OCAP is. You're teaching, like, how are we followed a really strict plan to make sure that, everything was given back to us, and we stored it away. Everything that was summarized, we stored it away in a really ethical way, and those were challenging, because even when you look and explore more of what First Nation organizations are provided, we don't have a lot of access to data sovereignty, right? And so making sure that we were, okay, how best can we do this? How can we make sure that we align with OCAP, we align with data sovereignty, but we have very little to pick from? And that was more of the behind the scenes challenges. A lot of what was shared in the conversation was the lack of resources that are available for families and communities. And I think we're advocates, and so we could, we have the audience of chiefs and ministers, and we have the audience of other individuals, but it's, I think the challenge is going to come after. Like, I think the challenge is we have something now, but now how do we prove to people that there needs to be expansion in these types of services. And one of the things we did after is we actually had our client navigator find out from each of our nations how much is provided to families when they experience a loss. And the reality of what is provided versus what it costs is something that we're starting to see. Yeah.
So, well, I guess that kind of begs the question, like, where are we now? We've done the engagement, we have the report, we're having these conversations now, but maybe more on the HQA side, where maybe you can shed some light on where the conversations are on your side of the fence. Yeah.
For sure. So a few things. I would say from this, and I've continued this through other work that we've kind of done through reviews, things coming up around family presence. So for example, again, family needing to be present. So whenever we're talking about or making recommendations about like hospital space, how can we weave into our work things like that, where it's planting seeds not just here, but in other things, or the home care. You already mentioned that, Dalton. 24-hour-a-day home care. How can we help to advocate and plant those seeds where we can as well, so that conversation continues. But the physical space is one that comes up to me a lot. I just think about some of those provincially funded hospitals where we do hear a lot about the rooms being too small, or even in our conversations we heard about how it would be excellent to have a kitchen where some food prep could be done there to be able to have a meal with a family member. So those things, I know I personally try to weave those in other places. But again, I really want to echo Margo's piece on the data sharing agreement that we had, which explicitly talked about the ownership, control, access, and possession of the knowledges. So I know I have tried very cautiously, again, this being our first time working together, to ensure that there is that trust that I'm not just walking around with these knowledges and misusing them or misinterpreting them. Even though I was there and was present and have been there for every step of this process, I really take that very seriously. And I mean, we have had to do some things, as Margo said, it was the back of house side, to ensure even just how the files are, the digital files that we shared, that those were, protected and looked after. So we've been waiting and just wanting to take guidance appropriately, and this is actually one of our first knowledge sharing opportunities that we're doing more formally about this. So taking the lead, but wherever the G4 Health Department says thumbs up, that looks good, but anytime I've ever brought a learning forward, I've always checked in with your team to ensure, is this acceptable? Does this feel good? Does this honor what we heard and how we heard it? Yeah.
And on our end, what we're doing in G4 Health is we're now starting to open in some conversation with, did you know we have this report that is now complete? So we went through give us the permission, and then we went out and did the engagement and have written the report and finalized it. And then we actually went back to the same elders to say, but now do we have your permission to go forward? And so this happened only a few months ago. And we wanted to make sure the elders gave us the blessing to take it forward. And so right now where we're at is really identifying who best do we engage with. And so recognizing different partners or different relationships that we're currently building. This might be really important to share with a lot of individuals. We have other presentations that we have within our Health Director Steering Committee, such as like Give Life Alberta, such as MAID. There's a lot of really heavy topics out there. And how can we use this as a learning opportunity to sort of set a foundation for some of those relationships? Before we really go into the nitty-gritty of those policies or those different laws that may exist, why don't we set the tone with this report? And so we're still really navigating together how best to bring it out, bring it forward. And we also give that same opportunity to our communities to say, do you want us to come and present to you? And a lot of the time it's sitting and waiting, and it's going to land somewhere where people will feel that this is a meaningful opportunity to share, but just being really gentle with how we push it, because it's a lot of this work. We have another project in G4 Health, which is our traditional healing program, that we're really careful how we put it out there, because we can't wave the end of life and palliative care flag, and we can't also do that with traditional healing. So how can we gracefully build relationships to be able to bring the conversation to light? But now we have a guiding piece. So when we do have the opportunity to have those conversations, we have a guiding piece that is like really rooted in prayer and empathy and compassion, and it's really, yeah, so it's cool. So, yeah.
And I know you just mentioned just the elders in their role through this, and I did want to touch on that most recent conversation where we did close the loop with them, because I think that helped me feel more comfortable with the knowledge sharing that we will be doing. Seeing how they connected, the reflections that they offered us. And then I think one thing that really hit for me was how anytime we're talking about this report, we need to be prepared to hold space for the similar type of sharing that we did at the gathering. There was a lovely elder that I was sitting next to, and there was just the nature of the conversation that day was a little bit heavy, and she kind of just poked me and said, I thought we were going to do some more sharing. And it was that moment where I was like, okay, anytime we're holding space to revisit this, it's almost like we're all at a new place, at a new stage, and we've had different changes in our own lives, or different people are experiencing loss at different time, and just navigating, and grief flows and sometimes catches us off guard. So we need to be prepared as we're doing that to hold space for similar kinds of conversations that we did at the gathering. And I really appreciated, again, that continued guidance that they have offered us at every stage. And I took that very much to heart at that follow-up session. And I think it just made me more thoughtful about how I support and am a helper with this in any future setting.
I wanted to ask Maz, did you see any, because it's the social determinants of health, and the data side, did you see anything that was really obvious looking at it from, the data collection and relating it to the social determinants of health?
Yeah, I mean, Kristina and I were just talking about this earlier, that the data analysis was something different than what we're typically used to. And so just even having the trust and the willingness to share that data back with us and having us do the analysis was special, and that we took that very seriously and to heart. And the whole concept around the Western way of doing analysis and kind of presenting the data back couldn't really be done with this approach, because these were all stories. These were stories that we had heard from different individuals with different backgrounds that were in different stages of either grieving or going through this process of end-of-life care within their communities or within their families. But specifically, with the social determinants of health, there was lots of things that we had picked out that there aren't really health policies or things that are related to service delivery within the system. It's actually more around cultural appropriateness and humility and understanding the wishes of the individual and the families that really contribute to the well-being and the outcomes. It's not the data or something that we're looking at specifically in terms of measures, but it's really understanding the cultural context, what's appropriate, what do we need to have for that individual or for that family so that they can pass gracefully, that's culturally appropriate. And I think that really resonated throughout the report, as well as what we heard from the folks, that individuals are in different stages, and these different stages have different levels of family gatherings or grieving, and they take it in different approaches. So as healthcare providers or people that work in the space, I think awareness and having that cultural humility and understanding of how these are different than typical cases that we may see in the hospital, that these families actually want to be together, and maybe you can't just restrict it to one individual to be in that room, and that it's actually more bigger, and that's really a central piece to having community involved at this kind of stage of life.
And does that overlap too? Not just, it's not Stony Tsuut'ina, but do you hear that in other circles in the HQ?
Yeah, absolutely. I think not only just within other communities, but family and gathering, especially like you're saying that when somebody passes, you start to see people that you haven't seen in a long time, and it brings people back together. But a lot of the procedures and things, especially during COVID, you couldn't do that, right? Those were a big no-no. And so For example, smudging within the room that you're in. Certain facilities aren't just equipped for that kind of stuff, and so having those conversations to make sure that there's appropriate space to have these ceremonies or have these cultural appropriate activities goes a long way. And that we heard that throughout the conversations, is that it's really to do with culture rather than how much money you make or where you live or the level of education. It's actually the people around you and the culture and the community that you have actually determines how healthy or your quality of life.
Oh yeah, it's like more the holistic. It's everything. It's not just one thing. Yeah.
This was a real challenging part for us, though, was to measure based on the social determinants of health, because that wasn't built before. Like, I'm sure in different ways, but for the purpose of this, we really challenged the HQA to be able to measure it, and I think there's a whole appendix that explains how it was measured, and we thought, let's not put the appendices in because there's going to be a lot of misinterpretation of that. But what was really interesting is when we did develop the measurement, even how we presented it in the report is, I think we started with kind of the smallest number to the largest number, and we said, let's flip it. So, even just a lot of the visuals in the report, we started to flip to what would really draw the eye to a reader who is not maybe working so full force in the healthcare system like we are, right? And the top three things that were highlighted, and we thought, oh my goodness, these all connect, which were culture, colonial impacts, and coping skills. And when you look at the interconnectedness of coping skills and colonial impacts and culture, they really relate. And I thought that was so, when we're drafting the report, I thought those three being the top were really interesting, because you look at a lot of our old ways in how we would honor our loved ones during this time were stripped from us and now are being reintroduced into our practices, or being relearned, or being, reconstructed even in some areas. There's a lot of changes to our world and that we have to adapt to, but even the colonial impacts of how we view and practice this part of our life. And when we look at some of the challenges that we reference, like home care, is even that is some of our people would want, if I'm a female, I would want a female to take care of me. Those are the types of things we had, is, our belief system is tested in how our care is provided to us. And we put, the healthcare system puts a lot of our family members and our citizens in uncomfortable positions because that's what's available to them at that time. And so it was really neat to do the measurement of social determinants of health. I think it was in our debriefing session to be like, okay, what do we consider? And that was brought up by one of the technicians in our group, and we're like, how do we do this? And so you did a phenomenal job in how you put it together. I know it was challenging, but it was difficult to display it in a really meaningful way. But I think how we did right by it. Yeah.
And I feel like the conversation that we had around how that was presented visually was so important, because I remember one of the things that came up with one of our technicians, Seema, when she and I were kind of wrestling with it first before we presented it to you all, was we were so conscious of, we've already talked a lot about how at the tables there was a lot of support for what was said. So it's like, even though maybe only one person said it, but you could tell it resonated for the whole table. So it was like, how do we communicate, I guess, the depth of that resonance? So how do we do that visually? So we knew it was powerful, but what's an appropriate way to do that? And then when we brought it to our full collective table, it really was one of the most interesting conversations that I think we had, because it was like, how does it honor it, but also really demonstrate just how much culture, colonial impacts, coping skills as those kind of top three really were a huge part of the conversations on that day and mattered a lot to the folks that were there.
Mm-hmm. Yeah, I know that does get the feeling of our table. Yeah, if you just open it and you could see the visuals, you could just kind of skim it and you get an idea of the overarching. Instead of a really super clinical report that's 150 pages. I've done research too, where I've had to go through a lot of reports and had to do my own synthesis. But I think this is nice where it kind of brings it together. Like I was able to pull out some reports and bring myself back to where the day I was there just by going over this morning. So yeah, I think it's pretty useful.
Even like how we displayed, like I know through this podcast we're not able to show the visuals, but you know, we're still at these very vulnerable steps of like, how can we put this safely out there? You know, how can we make sure that if we were to put it online, that it's not going to be used in a harmful way. So we're still exploring some of those things, but we were really challenged in finding a common central zone, I guess, to really understand how we're sharing some of the visuals. Like there's a word art in the document, and one of the questions was like, should we have all the font the same size? And we were like, well, we could, but why are we doing that? And so our understanding is you may have researchers that are looking at this that will maybe interpret the different size fonts as different levels of importance. And that wasn't actually the intent, but we never looked at that. And we said, let's put it as it is, because what was really beautiful of that word art in this document is love was at the center. And that's really what was pulled through a lot of this report, was that importance of love. And then even, you know, in another area of our work, we had an elder join one of our health director meetings, and his message to us is make sure you put love into your work. And my brain immediately went back to this report of how love was at the center, and it just like it hits you, right? And there's all of these other things happening, but it's that love that really kind of cradles you during these times.
That's why I wore my love necklace today, and we have heart berries on the table. But it really has infused every single step of this, so that was very conscious.
Nice.
Even the visuals, like we talk about that. If you look at the report, we found archive pictures of the Îyethka and the Tsuut'ina people. And it was really important for us to match these pictures to different parts of the report. So it was very intentional, and it was difficult because you're really listening to the stories and bringing it to life in that visual way. And there's even some really heartbreaking archived pictures in there, where there's a picture that we were so shocked that we found, because we're looking for, I think it was the emotional part of honoring the mindset. And so really those emotions and how we get through that. And we actually found a picture of two ladies grieving the passing of their head chief. And we're like, oh my goodness, how did this picture find us, right? And we put in there because it really shows that raw emotion that a lot of our people go through. But they also talk about, you know, the happy hunting grounds, and a lot of reference to the mountains and how that's our sacred place, where we go when it is our time. And we found these beautiful pictures of camps, and, you know, our horses there, and the mountains, and kind of in a valley. And we thought, this is exactly what our people are sharing with us in this process. And this is exactly what is captured through archives. And what we're doing is we're just continuing to share that story, and to piece pictures that we're taking, you know, over a century ago to what we did over a year ago is like, it's amazing. You know, you look at our ways are still alive and well, and for us to connect the two, like 100 years ago to now, to see like, oh my God, we found a picture that explained exactly what we're doing. It was a lot. And, you know, I have to give credit to Dalton, because he does, he likes to do I think he likes to do our research. And one of the things we said is, if we're going to use archive pictures, they have to be of our people. And so he actually built us a, I guess like a album, an inventory of archive photos of the Stoney and Tsuut'ina people that we're able to include in here. Yeah, so thanks, Dalton.
Thank you. Yeah, no, it's good. Yeah, I remember going to the Glenbow, actually. This is just the side. Yeah, and actually seeing the physical ones. This was before when I were communications with Tsuut'ina, but I've seen the physical archives where they have all of these photos of like Tsuut'ina, Stoney. I was like, this is so cool. No, I love it. Yeah, I do like it. So, and our communications guy can use them. Yeah, for our content. Yeah, you know. Right on. Sweet. What did I have?
So I know we didn't really the beauty of this process is we want people to read the report. We could sit here and read the report and have an audiobook of the report for people to listen to. But the goal really is to have people want to step into a space to say, I'm curious, and are you willing to share with me? And so we encourage listeners out there to be able to reach out to us. And we are exploring ways to maybe put pieces of the report into a public space, but recognizing that this is it's a sacred piece of work. I do look at it that way. Throughout the document, we actually talked about honoring the different elements of our life, so our heart, our soul, our health, and our mind. And so that we really go into a lot of that and what that means for everybody. We even talk about our physical well-being and how encouraging our citizens to be able to be physically prepared to bring our loved ones into those spaces, and even having our homes physically prepared to bring our loved ones into those spaces. We heard a lot about our infrastructure on reserve is lacking. When we look at the the comorbidities that exist in our communities, we're looking at larger coffins. We're looking at larger families. We're looking at a lot of different things that are not considered in maybe outdated builds in our community. There was reference to expanding doorways and making sure that homes are safe to bring our loved ones either home for care or either home to bury, right? Like there was a lot of that was referenced. And so we actually took everything that we heard, and this was a long process, but we came up with, I think it was 6 recommendations. I don't.
7.
Okay, so 7 sacred 7. 7 sacred. We went through. We actually put together 7 recommendations, and it was really important for us to connect them or measure them in a reconciliation manner. And that's where we referenced what United Nations Declaration on the Rights of Indigenous People article does this support, and what Truth and Reconciliation calls to action does this support. And we put all of them, originally we had them all written and what that says, but this is for our allies out there or for people who are wanting to gain understanding, this is an opportunity to say, well, I'm curious what Article 2 is, and they're going to go and find that. So it's really like this toolkit to actually broaden the knowledge set. And I wonder if, we could share the different recommendations. And then,
I know I did a lot of the looking up the TRC and UNDRIP. I remember just to check. A lot of them were very, it overlaps. Like one recommendation could be multiple articles. So I tried to include all the ones that could be relevant. Yeah, that was the little project.
And it was important for us to even put the purpose. So not just to put a recommendation, but to put, why is this a recommendation? So we're very purposeful with every step of this, because recognizing that we're going to have a multitude of individuals that will receive this and be able to build whatever they need to build around it.
So the first recommendation is that, I'll read it verbatim here and maybe we can elaborate a little bit more on it, but governments, organizations, and teams that plan, deliver, or address end-of-life and palliative patient, family, and community needs must include Dānít'ádā and Tsuut'ina representations at all levels and phases.
Yeah, so that goes into basically so we don't have resources made about us that don't include us.
Right.
Yeah, which came up like a lot.
Yeah,
the misinterpretation too, like the Western perspective, making sure that we're involved in just like we are now. So
making sure that we're engaged in like activities and participation needs to include free, prior, and informed consent, and be grounded in reciprocity, where there are mutual and meaningful benefits for all involved. Like, echoing what you said, like make sure it's coming from us and it's actually something that matters to us.
Right, and I think considering the distinct needs, like for example the sustainable funding for Tsuut'ina and Stoney, what we know at the Tribal Council is the distinction based and just not the pan-Indigenous approach. I think was what I got.
Even making sure that, let's give an example. You have an individual who may be in a hospital, to understand that even us as a tribal council, we don't speak for them. It's their family that speaks for them. It's the individual that speaks for themselves, and really honoring what this may look different for everybody. If your team is supporting one family, then this applies to the one family. If your team is supporting a nation, how do you bring those nation technicians into the conversation? So it's just making sure that there is that worldview that is respected and honored, there is inclusion. We've said it in this podcast, we hear it all the time, but it's for us with us, not for us without us. And one of the things that's really important is when you talk to people, you're checking a box. When you're talking with people, you're creating a relationship, and that's something that we have to honor. And that's what probably recommendation 1, I would assume, was really looking at. Mm-hmm.
And I feel like that's something, and this is just me, Chris speaking, in my time here, just observing, it can be really easy for us to get caught up in deadlines, objectives, all of those really fun terms. And so it can be easy to not do it with our peers and partners. And that is something that I know that we have talked about regularly, Margo, and others on your team, is not just being part of it and doing it together, but being brought in early. And so I know that that's something, like when I think about how I can personally try to help action some of these recommendations, that's something that I have a bit of control over, is suggesting and really encouraging our team to reach out and say, hey, we've been asked to do this piece of work now. Is this something that you're interested in? Should we be discussing this together? So this is one that I do feel that, in my role at Health Quality Alberta, I have some agency to help live this on a day-to-day basis, which is awesome.
I appreciate that, yeah.
I guess moving on to recommendation 2, again, I'll read it kind of verbatim and we can kind of discuss a little bit more from there. But recommendation 2 is develop and or expand culturally safe, ethical, end-of-life and palliative care spaces that consider the distinct needs of the Stoney Nakoda and Tsuut'ina cultures.
Yeah, I think we were kind of discussing too as well. And that, more so the keeping in mind the traditional healing spaces came up a lot. I also was going through the report this morning, was that people really they go to tradition in times of like a lot of stress and emotionals, and it's healing, like a cultural revitalization and traditional ways are healing. So I think having that in the space, in I guess the Western spaces are just accessible. So what I got from that,
Yeah, we really talked about like expanded spaces, so making sure that, it's not just like here's a big enough room for like a family to grieve. It's like, but is there, like Kristina did reference, like is there access to a kitchen? Because food is an essential part of this part of our life. What currently exists out there, and can there be an evaluation of spiritual spaces to say like, does this feel safe? We've heard in other areas that some of the spiritual like chapels in hospitals are triggering to some of our participants, because the first thing you may see is like a large cross on the wall that could be very triggering to somebody who may have had a really negative experience in their life. And so an opportunity is looking at ethical spaces and evaluating current spaces, but also having coordinators that are trained to be specifically for this area.
And that goes right into recommendation number 3 too, like expanding that training, education, and having those resources available for people to learn more, and not just learn about us, but that really emphasizing learning that it's about being grounded in humility and responsiveness. Consider that there are different needs for different people, different families, different communities, to recognize that the culture is different.
Yeah, and our organization has been going through a learning journey itself, and just even throughout the last couple of years and this process that we undertook, we're still growing and we're still learning, and it's an opportunity for us to sit back and also reflect on, where are the gaps and how can we do things differently, and the engagement that we have typically done may not be the most appropriate or way of connecting with individuals, and I think we're getting better. I think as an organization, our leadership team as well is really putting emphasis in this. And so that is great to see when, us technicians at an individual level work on projects and interact with certain folks, but if we don't have that same understanding at a leadership or an organization level, it becomes difficult. So I think it's really refreshing to see that we're moving into a space where we are vulnerable, that our typical ways of maybe collecting data, using data may not be the appropriate or the right one, but being open to the idea of and learning from other communities. And so I think that's what this is getting at. Recommendation number 3 is really to foster those relationships around training, education, not just within healthcare, but the broader community, and how do we kind of work together more to listen to one another and kind of bring some of those perspectives front and center before making decisions or writing reports.
This is a unique one too because we referenced youth in this one. And so how do we prepare youth, recognizing that we have a young population in our communities, and how do we build that confidence? Because some of the youth in our families are the leader of that family, or are the one that the family may go to solve all the problems. You know, I speak from experience sometimes, right? And it's a lot of pressure on some of the young adults, or even like the teenagers that may be the oldest in their family, to be able to be prepared to have these conversations. We're hearing a lot around this about developing end-of-life doula training. That's from the perspective of the Stoney Nakoda and Tsuut'ina, and even recognizing that this report, it has been almost 2 years in the making. So even we've evolved. So even how we reference our communities, we reference them now in a sovereign way. So when we talk about the Stoney and Tsuut'ina, we mean the Bearspaw-Chiniki Good Stoney and Tsuut'ina. So recognizing that we have 3 distinct nations within the Stoney reference of this, just at this time, we didn't identify them by each of the sovereign nations, but as a collective of Stoney people. And so that's important to recognize. But when we develop some of this training, that we've all, like Maz mentioned, we're vulnerable to the changes, you know, and sometimes we adapt as we go. And so, but the doula training was something that has been talked about, and the expansion of creating cultural competency training in this area as well has been really important.
I'll take the second half.
Go for it.
yeah.
Fully trust you.
Recommendation 4. Create a joint action plan led by the G4 Health team in the area of multi-jurisdictional member client improvement for communities facing end-of-life or palliative care needs. It's just creating a joint action plan. And I think the multi-jurisdictional is important because, you know, we see there's a lot of moving parts, a lot of different organizations. Sometimes things get lost in the mud of everything. So I think it's important to work together to bring all of our strengths, and, you know, better working together than against each other. So
and we're in that gray zone. Like First Nation communities, we're in a gray zone sometimes where we have involvement with provincial and federal. And so this is really understanding that. I think as a collaborative advisory group, we recognize that we live in multiple worlds, right, when it comes to a lot of our resources. But even in the recommendation 3, we actually even reference like the new evolvement of the current Alberta healthcare system, that a lot of these need to be considered in the acute care, like the 4. I think we do talk about it in here, but how do we ensure that these are included in palliative care, acute care, primary care, all of those areas as well.
Mm-hmm. Recommendation 5: create a feasibility plan for the creation of a Stoney and Tsuut'ina First Nations hospital. And this one came up a lot in the just from the conversations that we had on the day. I just remember we were talking, and even not even on the day, I hear that all the time. Mm-hmm. And I think a lot of it is from people just don't feel safe going to hospitals off the nation, and it's like it's passed along word of mouth, and it's become kind of the status quo to, everyone says, well, why don't we have something here, or why don't we have our stuff on reserve? So I think that just kind of goes hand in hand in like building the capacity and our resources on the nation. So we could have those options in the future if we wanted to. Mm-hmm. And that kind of aligns with the sovereignty too, of bringing back to our what we had before.
Exactly.
Yeah.
And we had hospitals in our communities, way back when, right? And I think that's what a lot of our elders and other knowledge holders in our community, we're trying to understand, why were those not expanded and enhanced? Why were they closed, right? And so it's just, but that's Dalton's world. So we bought a big book about Alberta's medical history that he's assigned to read. So
Yeah, kind of going down the Indian hospitals. So that's something that's draining too. That I gotta. But yeah, it's crazy. Just the history of the Indian hospitals and how, like the Treaty Right to Health. I think a lot of people thought that they were going to get really quality care because they were set up in the Indian agents, and some of them were much bigger in Edmonton. There were some, but in reality, they were not so great. We don't have Indian hospitals now, but I think the legacy is still there, which is tough. So recommendation 6: establish Îyethka and Tsuut'ina trust fund to help families afford the high costs associated with end-of-life and palliative care. That just goes hand in hand with what we talked about before, with our costs are not matching the reality, what we're provided.
And actually it ties to the previous recommendation about not having the hospital within the community, because a lot of it was about transportation, parking, bringing loved ones to the hospital. So it's like when you have to go away from home in order to receive palliative or end-of-life care, again, that just adds, in order to do it in ways that feel good or as good as they can be when you're away from home, there is a cost associated with that. So that actually came up quite a bit in our conversation, was just how can we support folks who just need support with those resources? What could that look like to have access to that?
Even like the unexpectedness of passing, you don't plan, some may have an indication, but some it comes abruptly, right? And families are just not prepared to host in their homes or feed, because that's like a lot of our ways. And it was even like cleaning supplies, making sure that families have access to cleaning supplies or having access to a team that can come in and help prep the homes. Like those were a lot of the stuff that we had talked about, is what if there were these end of life or palliative care teams that came in and just like cleaned up your house and got it all ready, the yard outside, making sure there's parking. Like those are the real realities, and recognizing that our First Nation communities aren't so close to, the grocery store or to the gas station or all those, and the transportation that comes in and the costs. And so this is something that we are still exploring. These are recommendations. We're still trying to understand how we bring them to life, but even some of these can be honored in other areas. It's not only our four nations that can benefit from these, it's other nations that could actually, or communities or municipalities or cities or whatever, that can start to build trust funds like this to help families in need, because it's definitely a need. There's a lot of dangers out there that are taking our people much too soon, and we can't really prepare for that.
Mm-hmm. And that kind of goes into with the recommendation 7, that internationally, like it's a create and influence culturally safe, ethical policy, locally, regionally, nationally, and internationally in preventive care, palliative care, end of life, and dying, in alignment with our treaty and inherent rights, both orally and written. And I think that's like a kind of a nice note to end the recommendations, because it kind of says there are a lot of similarities that are going on. And we can help each other with these, that hopefully that these recommendations and a lot of the work we're doing can go to inspire and influence good change, essentially, at the end of the day. Positive change, not just here, but everywhere. Yeah, that's how I looked into that one. And you can see the UNDRIP and TRC calls, there's a lot of articles, and it is like the most, because that really does hit the, hit where it really matters.
And that oral understanding of treaty is really important, and I think we brought that oral understanding, even that oral knowledge transfer, through this process, because we weren't sitting and taking verbatim minutes at every table. We were actually sitting and listening, and there were note takers, but we were not writing note, like word for word, expression for expression. It was tough. And then for us to sit back and actually write this, and I know I did a lot of the writing, and I was really felt supported by the extended team, because a lot of the analysis was what brought the writing to life. And I think without the analysis, without the stories, without the whole process, we wouldn't have been able to put something like this together. And yeah, it was so beautiful. And I think, like I mentioned in the beginning, I've had a long career in health advocacy, and this was one of the most unique things I've ever done. Yeah.
I agree. Honestly, this is probably one of the most generous learning experiences that I've had, not just here at Health Quality Alberta, but just within my professional career. And I think there's one quote from you, Margo, that has stuck with me in one of our stickier moments, where our team had been curious about something and asked your team a question, and I could tell that you were just wrestling with how to answer it, in ways that honored, protocol and respecting the sacredness of the knowledge, but still wanting to kind of welcome us in and help us feel comfortable. And you said, sometimes it's okay not to know. And it was that permission to appreciate that, even though, yes, we were partners in this, but there are always going to be certain things that, because I am personally not, I am not a Stoney or a Tsuut'ina person. However, I've tried to listen and learn through this, but it's okay that I'm not going to understand everything. And when that gets carried into the next stages as we move these recommendations, hopefully, and encourage and inspire some changes that participants and other community members can feel, I'll carry that with me as a big learning for myself, I think, through this. It's okay. It's okay. And having that permission to not need to know everything. I guess, when you're raised and taught in those Western and academic ways, it's like you want the curiosity is rewarded when you grasp it. But you don't always need that to learn.
And you can parallel it to our teachings. We all got rights in this process. We all learned something. Maz and I connected on a real formal matter when you think about it. It was my schedule that day was to go to this meeting, and that was whoever brought us together to bring this to life was probably not here in this room. They're probably guiding us from the spirit world, right, to be able to do that. And I think for Maz to really listen with your heart, to be able to not only take our concerns forward, but to help build something to actually address them and to build a template to address further, right? And I think that it's okay not to know. We didn't know what to do with it, and we did something with it. So.
Even I learned a lot. And even I listen to the elders. I always learn when you're listening with the elders in this work. I was like, oh, this is great, and I wasn't going to be questioning anybody. And I walked away, and I was like, oh, that's pretty interesting, because I'm Tsuut'ina. I learned some Stoney teachings. I think all in all, I appreciate you guys. Thank you for doing this. This is great. I think. Hopefully this goes and does some good stuff. Yeah, and I trust you guys. Thank you.
Don't take that lightly at all, and also understand that has to be continually earned. So I commit to trying to show up, trying to be a helper, and taking those corrections. Your team offered corrections in such supportive and gentle ways that made it easy to stay. Somebody that I sat with in circle in a totally different context had said, talked about growth mindset and fear mindset. And it's amazing how quickly, especially in these clinical spaces, folks can get scared fast. And then they retreat and they don't want to be present and they don't want to think about it differently or try to do something differently. So your team not only kept myself, but kept our entire project team in that growth mindset through the whole process. And even in those moments where it was, this doesn't fit or feels weird, and how do we work through it? No one ever stepped out. And I commit to continuing to show up and be present and try to be a helper in the best way that I can. And I don't mean that in a virtue signaling way. I mean that in a sincere, I want to be here. How can I help?
Right on.
Thank you for listening to today's podcast. You can follow us on Facebook at G4Health, or Instagram at G4_health. You can find more podcast episodes and information on our website at www.g4health.org. Nani stunning.